Welcome to this insightful video, where we're diving into the world of tonsillitis. This common bacterial infection impacts the lives of many people worldwide, and it's crucial to understand its nature and implications. Tonsillitis, more formally known as tonsil inflammation, is an infection that predominantly affects the throat. It results in a range of symptoms such as sore throat, swollen tonsils, fever, and difficulty swallowing. This condition is most often caused by bacteria such as streptococcus pyogenes and is typically spread through the air or by contact with an infected person. Understanding tonsillitis is not just about recognizing its symptoms, but also about knowing how to prevent it and what treatment options are available. Join us as we explore the causes, symptoms, prevention, and treatment of this common bacterial infection. So, what exactly causes tonsillitis? Well, tonsillitis is primarily a bacterial infection, with the most common culprit being streptococcus pyogenes, also known as group A streptococcus. This bacterium is responsible for a variety of other infections too, including strep throat and skin infections. The bacteria that cause tonsillitis are not shy. They are airborne, spreading through droplets when an infected person talks, coughs, or sneezes. They can also be picked up from contaminated surfaces, or through close contact with an infected person. Sharing a drink with someone who has tonsillitis, for example, can easily result in a new case of the infection. These bacteria are opportunistic, taking advantage of weakened immune systems to lodge themselves in the tonsils and start multiplying. This leads to the inflammation and discomfort that characterize tonsillitis. With this understanding of its causes, let's delve into the symptoms of tonsillitis. What signs should one look out for when it comes to tonsillitis? Well, the symptoms can vary, but there are a few key indicators that might suggest this infection is the culprit. One of the most common symptoms is a sore throat. This isn't your run-of-the-mill scratchy throat, but rather a persistent, painful sensation that can make swallowing a challenge. Next, the tonsils, those two oval-shaped pads at the back of the throat, may become swollen and red. This can sometimes be visible when looking in a mirror. Additionally, a fever often accompanies tonsillitis, making the individual feel warm or even hot to the touch. Finally, difficulty swallowing is another key symptom. This can manifest as a feeling of a lump in the throat or discomfort when eating or drinking. Recognizing these symptoms is crucial, but prevention is always better than cure. So stay tuned as we delve into how to keep tonsillitis at bay. How can we prevent tonsillitis from developing in the first place? Well, prevention primarily revolves around reducing exposure to the bacteria that cause the infection. Regular hand washing is a must, especially before meals and after using the restroom. This simple act can significantly decrease your chances of catching or spreading the infection. Steer clear of close contact with individuals who are sick, especially those showing symptoms of tonsillitis. This can include avoiding shared items like utensils, glasses, and other personal items. Maintenance of a robust immune system is another preventive measure. This can be achieved through a balanced diet rich in fruits, vegetables, lean proteins, and whole grains, getting enough sleep, and regular exercise. These habits not only fortify your immune system but also enhance your overall health. Prevention is key, but in the event of an infection, treatment becomes essential. What happens when tonsillitis sets in? How do we treat it? When tonsillitis takes hold, the primary goal of treatment is to alleviate symptoms and eradicate the infection. The first line of defense is usually antibiotics, particularly when the infection is bacterial in nature. Antibiotics such as penicillin or amoxicillin are commonly prescribed to combat the streptococcus bacteria, the most common cause of tonsillitis. Remember, it's crucial to complete the full course of antibiotics as directed by your healthcare provider. Stopping treatment prematurely may lead to a recurrence or even a worsening of the infection. In addition to antibiotics, symptomatic relief medications can provide much-needed comfort. Over-the-counter pain relievers like ibuprofen can help alleviate the throat pain and reduce fever. Throat lozenges or a simple saltwater gargle can also soothe a sore throat. Rest is another key component of tonsillitis treatment. The body needs to direct its energy towards fighting off the infection, and rest enables it to do just that. Along with rest, staying hydrated is vital. Drinking plenty of fluids helps to soothe the throat and keep you hydrated. Warm liquids like teas or broths can be particularly soothing. While these treatments can be effective, it's important to note that if tonsillitis becomes a recurring issue, a healthcare provider may recommend a tonsillectomy, which is the surgical removal of the tonsils. This is typically a last resort when other treatments have failed or tonsillitis is recurrent. It's important to remember that while tonsillitis is commonly a minor illness, it can become serious if left untreated. So, if you or someone you know is experiencing symptoms like a sore throat, difficulty swallowing, or a high fever, it's crucial to seek medical attention promptly. A healthcare provider can provide a proper diagnosis and treatment plan, ensuring that the infection is managed effectively and complications are prevented. Remember, seeking medical help is crucial if symptoms of tonsillitis develop. Tonsillitis, while common, is not to be taken lightly. This bacterial infection can cause a range of symptoms from sore throat and swollen tonsils to fever and difficulty swallowing. It's typically spread through the air or by contact with an infected person, which is why prevention measures such as regular hand washing, avoiding contact with sick individuals, and maintaining a healthy immune system are so important. Treatment usually involves antibiotics, pain relievers, and fever reducers, all under the supervision of a medical professional. Rest and proper hydration are also vital components of recovery. If you notice symptoms of tonsillitis, don't hesitate to seek medical help. A doctor can guide you through the necessary tests and treatments to ensure you recover fully and prevent recurrence of the infection. Stay informed, stay healthy, and remember, knowledge is the first step to prevention and treatment.